I'm ready. My name is Dolly Strong. I'm a public health nurse. And what I do, I go out and I do home visits. So I'm really involved within the community. I go out, I make sure that the babies are healthy, I make sure that the moms are getting prenatal care. And a lot of times when you're dealing with public health nursing, you're not dealing with your typical ambulatory or staff nurse in the hospital. We're involved in the community. So when we go into a family or into a home, we're doing something what we call holistic care. Not only do I see the parents of the infant or a pregnant girl, the family, what if they have a son that needs mental health care? What if they need help with their Medicare card? I call down there and I make sure that they get that medical card. I make sure that they get food if they need it. We have what we call pantry or food pantries. And in those food pantries, they provide food. A lot of times I go into homes, and a lot of times I go into shelters. And the shelters, they may transition from the shelter to an apartment. Well, they don't have any furniture, no pots, no pans. It is the public health nurses that make sure these families get some form of care as far as clothing, furniture, it could be a baby bed, it could be a stroller, so that life would be a little bit easy on them. Because when they leave from the shelter, they have nothing sometimes. So that's why it's so important that these clinics stay open. Because when you privatize, it's no way in the world that these nurses that they are going to hire, that's going to take our places, they are not going to service the community like we do. They are not going to do it. We make sure that they're able to get social care. We make sure that they're able to get at least food stamps. Make sure that they're tied in with kid care. Make sure they're tied in with Medicaid. These are the things that we do. It's holistic. We involve the whole family. I go in there, I may see a baby. Well, mom or grandma may be in there with hypertension. We went in one house. The sewer system had backed up. We had to get the whole family out. We had to vacate the whole family. Because here you're talking about hepatitis A, B, C, and D. All alphabets of hepatitis. But if we are taken out, what are the people in the community going to do? They need our service. They need these mental health clinics. They need the public health clinics. We have two what we call sister clinics. We have Uptown, we have Westtown, we have South Chicago, we have Roseland, Inglewood. All these clinics service the community. And they cannot close these communities. They cannot close the 7 public health clinics, and they cannot close those 12 mental health clinics. They are desperately needed. And unemployment is skyrocketing. That means with unemployment, that means you have no health insurance. If you don't have no health insurance, what's going to happen? They cannot bombard Cook County. I had a nephew who was out there at Cook County. It took him 2 days before he was able to get a bed. Because county to me is like Jesus. It accepts everybody. And county is overwhelmed. That's why it's so important to keep these clinics open, because what we call is preventive care. A lot of times we can prevent certain issues that will occur, and Cook County won't have to be burdened with the excess of it. I had a client that came in, a man from the shelter, had a positive TB exam. So usually when you have a positive TB skin test, that means you need 1 or 2 things. You need to do a sputum exam, or you also do the chest x-ray. The so-called FQAC, which means that means federally qualified health clinics. I called one of them, Community Health. I said, hey, he needs to see a doctor. He needs to get a chest x-ray, because our doctor and our chest x-ray tech, or our radiology tech, was out on vacation. So we had nobody at our clinic, because we're going through these changes. You know, they laying people off, they firing people. So I called the FQAC, Federally Qualified Health Clinics. I said, I need to get him in right away. They're there at Inglewood. They couldn't take him. They said, well, we can't see him until 2 months. Oh, really? Well, here you got a man that lives in the shelter. It's no way in the world, because we know that TB is airborne. If I breathe on you, it's contagious. You can contract it. So I said, you got to see him right away, because he needs a chest x-ray. They weren't any help. I had to send him to Cook County, Providence, on 51st, right off of Kings Drive. Now, these are the clinics that they're using to privatize, and they're saying that they're going to give quality service and better service. That's a farce. That's a farce. That man needed a chest x-ray, and anybody knows that's in medicine or in nursing know that you have to see them right away, and you must get a chest x-ray. And he fell through. So therefore, that safety net that they're talking about, the mayor says that we got the safety net, the commissioner says we have the safety net, it's not working. So they need to keep these clinics open, all 7 public health clinics, along with all 12 mental health clinics. And that's all I have to say.